It is the leading cause of cancer deaths. And listen to this. Each year, more people die of lung cancer than of colon, breast, and prostate cancers combined. So are you at risk of this cancer? We're talking about lung cancer, and so we're unpacking a lot today on The Healthy Dude. I'm Kurt Williams. We are joined by Dr. Stephen Noble, who we couldn't fit his title on the screen here or on his business card. Listen to this. Board certified cardiothoracic surgeon, which that right there just sounds pretty cool. Medical director of Chesapeake Regional's Lung Nodule lung cancer screening program and specializes in robotic-assisted thoracic surgery. You don't try to fit all of that on your business card, do you?
No, I don't, but thank you, Kurt. It's a pleasure to be here.
Thanks for being here. All right, you know, before we get into lung cancer, I see in your bio, all right, U.S. Navy veteran,
yes, indeed.
Authored several peer-reviewed articles and a children's book.
Yes.
What was the topic?
Dr. Daniel Hale Williams, The Heart of the Hero, the story of Dr. Daniel Hale Williams, the story about the first successful open heart surgery here in the United States, as well as the first interracial hospital that was started in Chicago. And so it's a children's book that really looks to inspire the next generation of physicians. And so it's one of the greatest things that I've done as far as being able to inspire the next generation. It was a book that got me inspired to pursue medicine. In my grandparents' encyclopedia, looking at that for hours, really inspired me to pursue medicine as a career and passion. And it was my humble attempt to try to do the same for the next generation.
Wow. I love this also. You practice the 4 F's: faith, family, fitness, and fun.
Yes, indeed.
What does that all mean to you?
Well, first and foremost, I'm blessed to do what I do. And so this is a God-given talent to really be able to get through the training, to really be able to have a support team to really, help me get through college, med school, residency. My family is very important to me. And then really being able to be fitness, try to stay as active as I can, but I also like to have fun. And so anytime I can get out there and have some fun, whether it's playing video games, spending time with the family, those are the things that I like to do.
And your faith, very important.
Yeah, very, very important. I like I said, I wouldn't be here without the God-given talent and without the support He has blessed me with.
All right. So I was stunned, first of all, to read that the leading cause of cancer deaths is lung cancer.
Yes.
And that it is more people die of lung cancer than colon, breast, and prostate cancers combined.
Yes.
I mean, we don't hear as much, I think, about the impact of lung cancer.
Correct. I think there's a lot of attention paid to the most common cancers that affect both men and women. For women, it's breast cancer, but for men, it's prostate cancer. But what we find is that for cancer deaths, the reason as to why people are dying from cancer is definitely lung cancer. And so this is really an attempt to really address lung cancer. And as we have noticed that the prevalence of smoking has gone down, as well as the prevalence of cancer deaths have gone down due to lung cancer, it's still pretty common. 1 in 5 people will get diagnosed with lung cancer, and therefore lung cancer deaths still continue to be a big problem within our country.
And I think you touched on it, but the leading cause of lung cancer is
smoking. And so the very small percentage of patients that get cancer that don't smoke, but by and large, smoking is the number 1 risk factor for cancer and cancer deaths.
What kind of smoking?
That's a great question. So typically we talk about cigarette smoking, tobacco smoking. Tobacco smoking, in particular with cigarettes, mentholated cigarettes are very addictive. And so when we talk about smoking and cancer, we really have to talk about addiction, because it's really the addictive property of tobacco and cigarette smokes that are very harmful. Vaping is still relatively new, and we don't really...
Because some people are thinking that they're doing something healthier by going from smoking to vaping.
Correct.
What would you say to people who think that?
Yes, I think it's still unhealthy. We're still learning a lot about vaping and really the lung injury that vaping can cause. And so studies will tell in the future as to really the long-term effects of vaping. But I would say that vaping is not a healthy alternative to smoking. I think the only healthy alternative to smoking is smoking cessation, whether that's nicotine patches, gum, or just going cold turkey. But that is very difficult difficult, and one of the things that we really try to help our patients with that journey.
But if you're wrestling with, because all right, I'm going to choose the lesser of two evils.
Yes.
So is it, and I know you're a doctor, but I mean, is it healthier to vape instead of smoke?
I would say no. And it's really because of the lung injury, the inflammation. We presume that is due to some of the vitamin E oils in vaping that can really cause some lung injury and lung damage. And over time, injury and damage is what can alter our DNA and can eventually lead to cancers when you have alterations in the blueprint that make our cells as they're dividing and making new cells.
Vaping can lead to lung cancer.
Correct. We believe it can lead to lung injury that can then lead to lung cancer.
Marijuana smoking.
Yes.
You've got states now that have legalized it. What should people know about whether that makes them vulnerable to lung cancer if they're a marijuana smoker?
That's a great question. One of the things that has been unfortunate with this country is a lack of good research as it relates to marijuana, and that's really been related to how it's classified. So with the states coming forth with legalization, the hope is that we will have more studies to really support studying that exact question. My response to, does it cause cancer? I think it's really related to how that marijuana is taken in. So depending upon some of the manners in which people take in THC or marijuana, whether it's in tobacco leaf paper versus smoking out of pipes, things of that nature, it all can really affect it. But at the end of the day, it really comes down to burning something and that foreign substance getting into your lungs causing injury. I say all that to say that I would presume that, yes, there may not be such a high association with lung cancer in regards to marijuana, but studies would have to be done to really determine that effect as far as smoking marijuana as it relates to lung cancer.
For the person out there who's determined that they're going to do marijuana, would you say what, gummies are hands down going to be a better alternative?
I would say that's a great question. So we do counsel patients as it relates to cancer and palliative care, and so I do say that if they are going to take THC or marijuana, to avoid the harmful effects of pollutants, the smoke and things of that nature, I would recommend gummies, edibles, things of that nature, rather than smoking it. Anything, if a patient has a history of cancer, a history of COPD, a history of lung injury, the thing that they need to do is try to avoid any sort of substances that can be very toxic to their lung. So the smoke that is produced from smoking any product can be harmful to the lungs. And so if there is a desire to really take in the marijuana, I would say edibles would probably be the safer or healthier alternative rather than smoking it.
So can you get lung cancer and you've never smoked anything?
Yes, you can. A very small percentage of patients do develop lung cancer without having smoked at all. I've had a close friend of mine. She developed lung cancer, never had a history of smoking cancer. I had a patient at Chesapeake who also had lung cancer, diagnosed in her 50s with lung cancer, and she had a very aggressive stage of lung cancer. Hers was stage 3.
How did she find out? I mean, how did she? What was tipping her off that something wasn't right?
Yeah, that's a great question. So she was having some shortness of breath and some chest pain. She ended up getting the imaging study, a chest x-ray. The chest x-ray showed a lesion that then followed a CT scan, and that CT scan demonstrated a mass. That mass was then biopsied, and she was found to have stage 3 lung cancer. She was a woman with very long, beautiful hair, and she was a hairstylist, and she didn't want to undergo chemotherapy because she was concerned about losing her hair. And unfortunately, she passed away from lung cancer. But the story that is hers is really one of those individuals that don't have a history of smoking cigarettes, and they end up getting diagnosed with lung cancer. Oftentimes, their lung cancer is a little bit more advanced and a little bit more aggressive.
Do we know why?
No, we don't. And that's, again, it really comes back to, as I counsel patients, cancer's in the DNA, and so we think it's really due to the alterations within the DNA that really lead to patients that don't have a history of smoking cigarettes to have worse forms of lung cancer.
Is there any insight on like for the people who don't smoke,
Mm-hmm.
on what family history? I mean, what might be some of the causes if you've been a non-smoker your whole life?
Yeah, so what we presume is it could be related to things within the air. So secondhand cigarette smoke, pollutants, how our body responds to some of the environmental contacts that we come in contact with every day. If a patient does have a family history of cancer, that may be something that would want to tip them off to getting checked or getting screened. If they are exposed to secondhand smoke, or if they're exposed to, especially in this area in which parents may work in the shipyard, they're bringing that asbestos home. Those are some of the things that could lead to someone having cancer, although they may not have smoked themselves. They have some environmental exposures to cancer. Maybe their parents worked in the shipyards. Maybe their parents were secondhand smokers. And then although our society is better.
So bring that home on your clothes?
Oh yes. The very, very known or a very good association for individuals that work in the shipyards, bringing that stuff home, even in working with older homes and paint. It's that asbestos that can lead to another form of chest cancer. Mesothelioma is the one that we really link to asbestos and asbestos-related exposures. But again, it really comes down to those environmental hits, those toxins that really affect our DNA. And again, it's when I get back to the DNA, because that's the blueprint of our cells to divide, make new cells. And if there's a mistake made, if there's a fly in the ointment, then every sort of replication thereafter could have that mistake. And those mistakes are what ultimately leads to the cancer.
So you touched on it a moment ago, but some of the telltale signs. I mean, some of the symptoms are what?
That's a great question. So with lung cancer, often the signs are no symptoms. And so with early stage lung cancer, you may not have any symptoms whatsoever. Typically, it's cancer will present with symptoms later on. So shortness of breath, coughing up blood. Sometimes patients can have chest pain, weight loss. Those are oftentimes the symptoms of cancer. But typically, when you have symptoms of cancer, especially lung cancer, it's a little bit late. And the goal for us is really to diagnose lung cancer as early as possible. So typically, we're talking about diagnosing lung cancer before anyone has any symptoms whatsoever. So unfortunately, when I do see a patient there coming to me with chest pain, shortness of breath, or coughing up blood, and it appears that they do have cancer, unfortunately, it may be that their cancer is a little bit more further downfield than what we would like it to be.
So when you talk about screening,
yes,
I mean, is that something that should be taking place during your annual physical? Or I mean, how do you know? I mean, like with me, because of my family history with prostate cancer, my father successfully treated for prostate cancer. I knew, all right, I was going to need to start earlier for prostate cancer screening, and then also, being an African American male, I know we have such a high rate of prostate cancer. So I knew, there were pretty clear guidelines. What are the guidelines for screening for lung cancer?
Great question. So there are clear guidelines for lung cancer, and it goes back to what we discussed before as far as smoking and smoking history. And so both with the U.S. Preventative Task Force as well as CMS have guidelines for individuals that have smoked more than 20 packs per day for more than one pack per day for 20 years, or a 20-pack year history of smoking. Those individuals should get screened for with a low-dose CT scan, so a CT scan or a picture of their chest to see if they do have lung cancer. And those individuals from the age of 50 to 80 are the ones that we should screen. So if you're not a smoker and you don't have a family history, then are there any guidelines on when you should start, or should that person be screened at all if you don't have a family history and you're a non-smoker? That's the difficulty. And so currently there aren't recommendations for those that don't have that family history. And so oftentimes, my mother was diagnosed with lung cancer, and she was not a smoker, and her lung cancer was found incidentally, meaning that she went into the hospital for another reason. Her esophagus, she had some nausea and vomiting, and she had a tear in her esophagus. That required her to go to the hospital. They did a CT scan to really figure out what was going on, why was she having the nausea and vomiting. And due to that CT scan, they saw that she had a very small nodule in the top portion of her right lung. That then prompted a biopsy, and that biopsy demonstrated that it was lung cancer, and then she subsequently went on to have surgery to remove that cancer. So I say all that to say that it was found incidentally, meaning that oftentimes, a lot of my patients that I see, it's an incidental finding, meaning they get an imaging study for some other reason, and that imaging study shows a little nodule or a little ditzel in their chest that prompts workup to figure out if that's cancer or not.
And she was a non-smoker.
Correct. She was a non-smoker. Now, my grandmother did smoke, and so she was an individual. My mother was an individual who grew up with a mother that smoked, and so she was exposed to secondhand smoke. And my grandfather worked in the shipyards, so there's a history of asbestos exposure potentially from coming home from the shipyard, having a mother that smoked almost 2 packs per day, and so there was some environmental exposure to secondhand smoke and asbestos exposure, although my mother wasn't a smoker herself.
So, would your best hunch be that between a father working in the shipyard and your mother being a smoker and you being exposed to secondhand smoke, that potentially led to your mother's lung cancer?
Oh, I definitely would think that. And I think the difficulty would be, how do we as a community and society kind of screen individuals that may have exposures, may not meet the criteria that are covered by CMS or recommended by CMS or the U.S. Preventive Task Force as far as meeting the criteria for screening.
CMS?
Centers for Medicaid Services.
Okay. So at the Lung Nodule Lung Cancer Screening Program, what do you do there?
So it's a group of individuals working together, really trying to diagnose lung cancer as early as possible. So we provide a service to our primary care providers and other providers within the community to help them screen their patients for lung cancer. And it really goes back to those individuals that meet the criteria for lung cancer screening. They've had a greater 20-pack year history of smoking. They're in their ages of 50 to 80. And if they meet that criteria, we help coordinate getting a low-dose CT scan annually. So for those individuals that meet that criteria, they should get a low-dose CT scan every year. And so what we provide is helping that patient get that CT scan, informing them of what the results are, and then we as a group of pulmonologists, lung doctors, physicians that specialize in lung physiology, lung diseases, as well as thoracic surgeons, surgeons like myself who really specialize in lung cancer surgery. We put our heads together and figure out what's the best way to help manage this patient. Should this patient get another CT scan in a year, or should they get some sort of biopsy? Should they go on for surgery? Should they get another type of scan, a PET scan, to see if this image that shows up or this nodule that shows up, does it show activity of potentially being cancer? So the goal is really to try to find cancer as early as possible, because if we do, we can treat it and give patients a good quality of life.
What are the treatment options?
So the treatment options are varied. It can range from surgery in cutting the cancer out to giving radiation treatment. It can also include chemotherapy and immunotherapy. So at Chesapeake Regional Medical Center, we have a multidisciplinary team, meaning that we have providers from all disciplines, from oncology, radiation oncology, pulmonology, the lung doctors, and myself, as well as other cardiothoracic surgeons, really putting our heads together to really figure out what would be the best treatment for this patient with cancer, because some patients are great candidates for surgery, whereas other patients, they can't tolerate surgery, so maybe chemotherapy and radiation therapy is the best thing for them. Maybe the patient should get chemotherapy and immunotherapy before surgery, have surgery, and then have some other form of treatment thereafter. So cancer treatment can be very varied, and so we really try to do a great job in trying to give the patient the right treatment for them at the right time for what their body really needs.
What do you want the big takeaway to be for the people who are listening to this, who are wondering, like, well, what is the most pressing takeaway?
I think the most pressing takeaway is what you mentioned before. Lung cancer is the #1 cancer killer of Americans. However, it is treatable, and it is treatable by being able to diagnose it as early as possible. And so for those individuals that meet criteria, we should get a low-dose CT scan for them.
But for the people who get a scan,
yeah,
and they say, I'm not going to, have you met people who said, I'm still going to smoke?
Oh yes. Smoking cessation is difficult. It is an addiction, and it's very hard to get people to stop smoking.
So when you tell them that they are on the path to lung cancer? Or I mean, have you had any patients where they've been diagnosed with the lung cancer and they say, "I'm still going to smoke"?
I have, yes.
What do you say to them?
I work with them. I mean, it's a relationship, and so first and foremost, understanding that smoking is a very difficult thing to stop. It's addicting, and so you're dealing with the disease of addiction. And so, working with patients that really have to struggle with the disease of addiction is something that is important. However, trying to withhold treatment for lung cancer because of this addiction, I don't think is the right thing to do. So, first and foremost, we have to work with the reasons as to why they smoke in the smoking, and try to encourage them that even if they don't stop smoking, smoking less is important. So if they're smoking 2 packs a day, well, cut down to 1 pack a day. And so I have patients in which we encourage trying to wean off of the cigarettes as much as possible, providing nicotine or some other alternatives to really help them wean off of the cigarettes and get them to stop smoking.
And then the takeaway for the people who are vaping or smoking marijuana, who may think, well, it's not tobacco, so it doesn't have all of those carcinogens. I mean, what do you want to say to those people who are vaping? Your big takeaway for the people who are vaping and smoke marijuana.
Yes, the big takeaway is that in order to really protect your lungs, in order to avoid the #1 cancer killer of Americans, trying to avoid any sort of pollutants, any sort of toxins to our lungs is key. And what we do know is that any form of smoke can be toxic and be a pollutant. And so really to stay away as much as possible from those products that cause injury to our lungs, so vaping causing injury to our lungs, and then how we take in marijuana and marijuana type products is also key. And so if you're going to smoke it, you're going to create some smoke that can cause some potential carcinogens and increase your risk. So I think providing my patients with that information and then working with them to really give them the best quality of life is what I really try to do.
Dr. Stephen Noble, thanks for
thank you for having me. It was my pleasure.
All right, board certified cardiothoracic surgeon, medical director of Chesapeake Regional's Lung Nodule Lung Cancer Screening Program. Good to have you on, and let us also remember to when we can practice, what is it? Faith, family, fitness, and fun.
Yes.
You got 5 children and 2 grandchildren.
Yes, I do.
All right. Thanks for joining us today.
Oh, thank you so much.
And thank you for joining us on The Healthy Dude.